Hello, everyone. It is so good to be back on the air alive. The last time we were here with you was in February of this year, and for 4 months we haven't been able to come to you live, but we have aired some reruns of some of our past exciting shows. I know that this mic has been sanitized, so I'm going to take off my mask. But as you can see, the mask is the look of the day. Wearing the gloves and taking all of the precautions for being involved with COVID-19 and trying not to be involved with it in particular because it has had a devastating effect on our community as well as on our country. We know that right now there are over 137,000 American citizens that have lost their life to COVID-19. We know that there are nearly over 1 million individuals across the country that have been infected by COVID-19. We know that it has touched all segments of society. We know that it has touched every age range from infancy all the way up to our senior citizens, and it is having a traumatic impact. One of the things that it's impacting is the day-to-day lives of our citizens and causing them to experience trauma. A traumatic event is when a shocking or scary or dangerous event occurs, and it can affect someone emotionally or physically. And experiences like disasters or this pandemic, like hurricanes and earthquakes and floods, acts of violence, are the type of things that can trigger and increase the risk for people to have a physical or mental health problem following that traumatic event. Responses to trauma can be immediate, and they can also be delayed. They can be brief or they can be prolonged. Most people have intense responses immediately following and often for several weeks or months after a traumatic event. These responses can include feeling anxious, sad, or angry, trouble concentrating or sleeping, continually thinking about what happened. For most people, these are normal and expected responses, and they generally lessen with time. But in some cases, these responses continue for a longer period of time and interfere with everyday life. And if they are interfering with your daily life, and you're not getting better with time, it is important to seek professional help. And some signs that an individual might need help are when they're worrying a lot or feeling very anxious, sad, and fearful. They're crying often. They're having trouble thinking clearly and being able to focus and concentrate. They're having frightening thoughts or flashbacks, reliving the experience over and over again. They're feeling angry, resentful, or irritable. They're having nightmares or difficulty sleeping. They're avoiding places or people that bring back disturbing memories and responses. And they start becoming isolated from friends and family. Children and teens can have different reactions to trauma than those of adults. Symptoms sometimes seen in very young children that are less than 6 years old can include wetting the bed or after having learned to use the toilet, forgetting or being unable to talk or forgetting how to talk, acting out the scary event during playtime, and being unusually clingy with a parent or another adult. Older children and teens are more likely to show symptoms that are similar to those seen in adults. They may also develop disruptive, disrespectful, and destructive behaviors. Older children and teens may feel guilty for not preventing injuries or deaths, and they may also have thoughts of revenge. Physical responses to trauma may also seem that an individual needs help. Physical symptoms may include headaches, stomach ache and pains and digestive issues, feeling tired all of the time, a racing heart or sweating, and being very jumpy and easily startled. Individuals who have a mental health condition or who have traumatic experiences in the past, who face ongoing stress, or who lack support from friends and family may be more likely to develop more severe symptoms and need additional help. Some people turn to alcohol, others turn to drugs to cope with their symptoms. And although substance use may seem to relieve the symptoms temporarily, it can also lead to new problems and get in the way of recovery. Now, there are ways to cope with trauma, there are ways to cope with stress, and the reason I want to emphasize some of these ways is because often trauma can lead to thoughts of suicidal ideation. And we want to avoid the thought of suicide. But if a friend indicates in any way that they are thinking of or considering suicide, then you need to question them to find out how they're feeling and why they're feeling them the way that they do. Then you need to persuade them to get help, and you need to refer them to a professional that can give them the help that they need. And that process is called QPR: question, persuade, and refer. Some of the healthy ways to cope during a time period of high stress and traumatic events is avoiding alcohol and other drugs, spending time with your loved ones and trusted friends who are supportive, and trying to maintain normal routines for meals, exercise, and sleep. In general, staying active is a good way to cope with stressful feelings. And I know that we are feeling stress, and we are feeling stressed out because of COVID-19, because of being locked down or in quarantine, because of self-isolation or isolation of the groups that we interface with. It's causing us to have stress. It's causing us to have trauma. It's causing us to abuse substances, and we are finding that the suicide rate has been increasing. Some of the places that you can find help for mental health conditions to be treated is to go and visit the Taking Control of Your Mental Health Tips for Talking with Your Healthcare Provider. And you can get that from the NIMH Help for Mental Health Illness page. And all you need to do is go or call the National Suicide Prevention Lifeline. And that is 1-800-273-TALK or 273-8255. And you can also text the crisis text line, and you would text the word hello to 741-741. And you will be able to get some assistance. And you can also visit the Lifeline Support on Social Media webpage. Once again, that's Lifelines on Social Media. And all of these will give you information about stress management, suicide prevention, substance abuse prevention. Once again, that is the National Suicide Prevention Lifeline. And that number is 1-800-273-8255. That's 1-800-273-TALK. And anytime one of your friends or family members, associates, or acquaintances makes a comment about suicidal behavior, please take that comment seriously. Anybody that mentions the desire to die or wishing to die, take that comment seriously, even those said by children and by teenagers or adolescents. Even if you do not believe your family member or friend will attempt suicide, excuse me, the person is in distress and can benefit from your help in finding treatment. You can learn more about suicide prevention on the suicide prevention webpage. And there are also, once again, you can call the National Suicide Prevention Hotline at 1-800-273-TALK. That's 1-800-273-8255. Other places for assistance are veterans can get assistance from the Veterans Crisis Line, and that number is 1-800-273-8255, and simply press 1, or you can text 838-255. Once again, text 838-255, and you will be able to chat online and get some support. Just text the word hello to 741-741, and you will be able to get free and confidential support 24 hours a day. And if you would like to get involved in a study, there are some clinical trials that are taking place, and you can go to the www.NIMH, that's the National Institute on Mental Health, at www.nih.gov/help/topics/coping, and you will be able to get some help and some assistance. Also, you can contact the Department of Health and Human Services, the Michigan Department of Health and Human Services, and they offer service members and their families resources to help them cope. They also have caring for children in disaster. So you can contact the Department of Health and Human Services and be able to get some support. Then locally, you can contact, if you need support for income or food, you have a plumbing emergency, you have a water or energy emergency, you need assistance with your rent or your mortgage, you need support for your property taxes, even if you need support for funeral services, you can go to Wayne Metro. And that phone number is 313-388-9799. Or go to www.waynemetro.org/cares. That's www.waynemetro.org/cares. And they will be able to give you assistance with food or income, if you have a plumbing emergency, a water or energy emergency, if you have a rent or mortgage payment emergency, if you are having issues paying your property taxes, or if you are dealing with the untimely demise of a relative or an acquaintance or friend, and you do not have the resources to provide proper burial, please contact Wayne Metro, and they will provide you that assistance. And then also, my friends at the Detroit Association of Black Organizations, that's the Reverend Horace Shetfield and his team at Dabo, are providing frozen food giveaways every day of the week, Monday through Saturday, from 10 to 12 a.m., from 10 a.m. to 12 noon, and that location is 12048 Grand River. That's right at the corner of Grand River and Wyoming, and you will be able to get free food, and they also are providing free COVID-19 testing. Then, again, the city of Detroit is providing coronavirus testing for free at the state's fairgrounds. And if you do not have the ability to get to the state fairgrounds, they're providing $2 transportation rides to the state fairgrounds, as well as access to physicians and doctors. And in order to get that assistance, go to Detroit, Michigan, or DetroitMI.gov/coronavirus. That's DetroitMI.gov/coronavirus. TROITMI.gov/coronavirus. And you can get assistance for testing of the coronavirus at the state fairgrounds. We're going to just take a brief break right here, and we will come back with some more information. We've had an opportunity to have a lot of free time, and we've been searching and researching the annals of internal medicine to learn more about the coronavirus. We have also had an opportunity to work with the Children's Center and provide some COVID-19 survival kits for the members of the Young Adult Self-Sufficiency Program. And we want to share that information and tell you all about that. And so we'll be right back after this break so that we can recognize some of our sponsors that have been providing us assistance and support throughout this Corona-19 pandemic that we're experiencing.
Love your Avis Ford, because at Avis Ford, we make it easy to get you your no money down monthly payment right over the phone. We call it Shop by Phone, and it's the best way we know to get you your payment options fast. You want leather and a sunroof? How about an upgrade to all-wheel drive? Just give us a call. Shop online, shop by phone, or visit us at Telegraph at 12 Mile. Call 1-800-SHOP-FORD.
Meet Danny, high school senior, 17 years of age, all A student. Danny is just now finding out he scored 1,490 out of 1,600 on his SAT. Danny's friend decided to ask, "How did you do it?" Danny replied, "I believe every day is a test. To fail or succeed, you choose." The effects of vaping is the one test that Danny chose not to study for.
Vaping does not discriminate on who becomes addicted. Over 2 million high school students use some type of electronic cigarette device. The top tobacco companies also own vaping devices. The FDA found that vaping contains some of the same toxic chemicals as regular cigarettes that lead to cancer. So whether you smoke traditional cigarettes with tobacco or smoke electronic cigarettes using nicotine, your health is at risk. There's no safe way to smoke. For more information, contact the Center for Urban Youth and Family Development.
The non-medical use of prescription drugs, including opioids, is a growing concern in our communities, affecting all ages, including our youth. If the medication wasn't prescribed to you or has expired, don't take it. If your name isn't on the bottle, it's not meant for you to swallow. Addiction is real, and lives are being ruined. Or worse yet, lost.
Visit PreventionDetroit.org/opioids to find prescription Dropbox locations.
Welcome back and to Urban Review, and I just wanted to kind of follow up on the public service announcements and commercials that you just heard regarding the impact of COVID-19 on addiction and the epidemic. People with substance use disorders may be especially susceptible to COVID-19, and compromised lung function from COVID-19 could put a risk for those who have an opioid use disorder and a methamphetamine disorder. This commentary that I'm going to share with you describes the risk of the collision of COVID-19 and the addiction epidemic. Corona-19, or the coronavirus, is causing untold challenges to healthcare and a wider social structure. Among the vulnerable populations are persons who smoke or vape, use opioids, or have a substance use disorder. Because of the direct challenges to respiratory health, those with substance use disorders may be especially susceptible to infection by the virus that causes COVID-19 and associated complications. And because of the implications to delivering care to this population, the impediments of delivering care to this population, persons with substance use disorders who develop COVID-19 may find it harder to get care. Those in recovery will also be uniquely challenged by social distancing measures. Risk for severe COVID-19 and death escalates with older age, but is also concentrated among those who are immune compromised or have underlying health conditions, including diabetes, cancer, and heart and respiratory illnesses. Many of the latter arise from smoking and thus may increase risk for death and illness among smokers, and that includes tobacco or cannabis users. Data from the Chinese Center for Disease Control and Prevention has suggested that COVID-19 has a case fatality rate of 6.3% for individuals with chronic respiratory disease compared with only 2.3% overall. One, comorbid chronic obstruction pulmonary disease, cardiovascular disease, and other respiratory diseases, which are more frequent among chronic smokers and persons with substance use disorders, have been shown to worsen prognosis with other coronaviruses, including those causing severe acute respiratory syndrome and Middle East respiratory syndromes. Persons whose lungs may be compromised from vaping nicotine or tetrahydrocannabinol or even just the flavorings may also be at risk. The highly publicized lung illnesses from vaping, including popcorn lung and e-cigarette or vaping product use associated lung injury, alert us to the potential for lung injury from vaping, which is on the rise, especially in young persons. Preclinical studies show that e-cigarette aerosols can damage lung tissues, cause inflammation, and diminish the lung's ability to respond to infection. So we see that persons with substance use disorders may face challenges obtaining medications, or obtaining services for syringe programs. Social distancing will increase the likelihood of opioid overdoses happening where there are no observers who can administer naloxone to reverse them, and thus when they are more likely to result in fatalities. Emergency department physicians with increased caseloads may be less likely to initiate therapy for patients with substance use disorders, which is an important component of the likelihood of fatality. So also we find that the Substance Abuse and Mental Health Services Administration has advised opioid treatment programs to provide take-home medication more flexibly during the pandemic, and the Drug Enforcement Administration has issued guidance to facilitate controlled substance prescribing. Persons with substance use disorders are already marginalized and underserved by healthcare services, largely because of the stigma. Much of this stigma is based on the erroneous but persistent belief that widespread among even healthcare workers that addiction is the result of weak character and poor choices, where science has clearly shown it to be a disorder arising from alterations in the brain circuitry. When hospitals are pushed to their capacity, there is added danger of persons with substance use disorders being deprioritized for care if they present with COVID-19 symptoms. It is incumbent on all healthcare workers not to discriminate against patients with substance use disorders and to treat those individuals with compassion and dignity as they would with any other individual. So I just wanted to share some of the impacts that COVID-19 is having on the substance use disorder and substance use prevention community. And we know that it is having a traumatic impact, but we want you to continue to try and work towards leading a safe, sober life. And I just want to go over some of the opportunities that I told you about If you are having issues with your food, income, plumbing, water or emergency, rent or mortgage, property tax, or the ability to provide funeral services, reach out to Wayne Metro at 313-388-9799. And if you know someone that has been considering suicide, please have them call the National Suicide Prevention Hotline, and that number is 1-800-273-TALK, or that's 1-800-273-8255. And as we come to a close of our program, we'd like to thank all of you for continuing to support the Center for Urban Youth and Family Development, the Coalition for Urban Youth and Family Development. We recently had an opportunity to provide 70 COVID kits to youth and the Young Adult Self-Sufficiency Program with the support of the Omega Psi Phi Fraternity, the Children's Center, and Mr. Jim Throer and the McDonald's Corporation. Please patronize the McDonald's on the corner of Livernois and 6 Mile. They were so kind as to provide us with 152 $5 gift cards with the support of the Omega Psi Phi Fraternity. And as we come to a close of today's show, I want to wrap up as I always do, saying when you're up against the trouble, meet it squarely face to face. Plant your feet, set your shoulders, lift your chin, and take a brace. And when the worst is bound to happen, in spite of all that you can do, you may fail, but you may conquer. See it through. Black may seem the clouds about you, and the future may seem grim, but don't let your nerve desert you, and keep yourself in fighting trim. And when the worst is bound to happen, in spite of all that you can do, remember, running from it will not save you. You've got to see it through. Even hope may seem but futile when with troubles you're beset, but remember, you're simply facing what other men have met. So if you fail, fall, still fighting, and don't give up whatever you do, keep your eyes to the front, your head high to the finish, and see it through. So let's see it through COVID-19, and let's see it through until we get to a disease-free and pandemic-free America. Thank you for watching Urban Review.